So how much vitamin D we should take to get the most of the benefits of vitamin D, both skeleton and extraskeleton? To understand that, we need to measure 25-hydroxy D3 in our blood. There are two units for measuring concentration of 25-hydroxy. One is nanomole per liter and the other is nanogram per milliliter. 1 nanomole per liter is equals to 0.4 nanogram per milliliter. The units that we'll be referring to would be in nanograms per milliliter, but you could also see the equivalent values on the screen. Anything less than 12 milligrams per milliliter is considered as deficiency. It can lead to osteomalacia in adults and rickets in children. Anything between 12 to 20 is considered as inadequate for bone and overall health. Anything above 20 is considered as adequate for bone and overall health. And anything above 50 can have potential adverse effects. Therefore, the sweet spot might be the region around 30. So why I'm saying might be? Because it's still not very clear the exact value that you need to have to make the most of vitamin D. However, there is a tribe in Tanzania, Africa, known as Halza. They live very close to the equator. They are hunter-gatherers. They don't wear much clothes, so most of their skin is exposed to the sun, and they get a lot of it. And when scientists went to this tribe and measured their level of 25-hydroxy, which is vitamin D3, they found that they have levels in the region of 48 to 52 nanograms per milliliter. So you could consider this as our ancestral levels of vitamin D, which is way above what is recommended by the Institute of Medicine. So it's begged the question, what is the right amount of vitamin D? And hence, there is still a lot of research going on into vitamin D to understand what is the maximum limit of vitamin D that you can take that it would still be safe. One of the concerns that many scientists have about this vitamin is that it is a fat soluble. What does that mean? That means if you take a lot of vitamin D and there is too much of it in your blood, it would be stored in your fat, and anything stored in your fat for a very long time, and if it accumulates, it can have bad effects on your body. Taking too many vitamin D supplements over a long period of time can cause build-up of calcium in the body, also known as hypercalcemia. This can cause weakening of the bones and the damage to the heart and the kidney. So how much vitamin D should we take? Either from the sun, from supplements, or from the food sources? There are two organizations that recommend the intake of vitamin D. One is known as Institute of Medicine and the other is Endocrine Society. Institute of Medicine looks at the whole body, but the Endocrine Society looks at the hormones in our body. Both these societies agree on the amount of vitamin D we need to take to maximize bone and muscle functions. However, Endocrine Society also gives an additional value of vitamin D intake so that you could get your vitamin D levels in your blood more than 30 nanograms per milliliter. So you could see those values on the screen to my left when I start talking about the vitamin D intake. There are two units to measure the intake of vitamin D. One is known as international units and the other is microgram. If you're good at maths, 1 microgram is equals to 40 international units. International unit was used because vitamin D can be in the form of vitamin D2 or vitamin D3, and they both can have different potency. So it's not just about how many grams of vitamin D you take, but whether you take vitamin D2 or D3. Hence, they decided to give a unit that could measure its potency rather than the weight. Therefore, infants up to 12 months old, they need to take 10 micrograms. From age 1 to age 70, they need to take 15 micrograms. From age above 70, you need to take 20 micrograms. Bear in mind that if you're taking medications such as the ones that are on the screen to the left, you will need to take 2 to 3 times more than what I've specified. For more details, please refer to this table, which states both Institute of Medicine recommendation as well as Endocrine Practice Guideline Committee for patients at risk for vitamin D deficiency. AI means adequate intake, then we have estimated average requirement, and then we have tolerable upper limit. One interesting thing to note is tolerable upper limit are different for these two categories quite substantially. For example, here 19 to 30, it says 4,000 IU, here it says 10,000 IU. And it gives you for different age group in a more concise manner